Chapter 4: A Skilled Workforce and Excellent Leadership. The multitude of professionals who deliver for children and young people with SEND in early years, schools, colleges, health and care settings, specialist and alternative provision, local authorities and beyond are dedicated, highly skilled and passionate about meeting their needs. Throughout the consultation process, we heard clearly that reform is not possible without a strong and capable workforce with robust leadership. Any reform must build on the extensive expertise held by the sector. And focus on setting consistent standards and incentives to build one united workforce around the child or young person. To support a skilled workforce and excellent leadership, 1. We will introduce a new leadership level Special Educational Needs Coordinator National Professional Qualification, or SENCO MPQ, for schools. 2. We will review the initial teacher training and early career frameworks, commencing early this year. 3. We will fund up to 5,000 early years staff to gain an accredited Level 3 early years SENCO qualification. To support the early years sector, with training running until August 2024. 4. We will increase the capacity of specialists, including by investing a further £21 million to train 2 more cohorts of educational psychologists in the academic years 2024 and 2025. And, in partnership with NHS England, as part of our £70 million change programme, pioneering innovative practice through running early language and support for every child, or LSEC pathfinders. To improve access to speech and language therapy for those who need it. 5. We will work together to take a joint Department for Education and Department of Health and Social Care approach to SEND workforce planning. Including establishing a steering group in 2023 to oversee this work, which we aim to complete by 2025. 6. We will publish the first 3 practice guides for frontline professionals, building on existing best practice, including the Nuffield Early Language Intervention, the work of the Autism Education Trust, and the government's guidance on promoting children and young people's mental health and well-being. Seven, we will propose new guidance on delivering a responsive and supportive SEND casework service to families when consulting on the SEND Code of Practice. 8, we will develop a longer-term approach for teaching assistants to ensure their impact is consistent across the system. 9, starting with a research project to develop our evidence base on current school approaches, demand and best practice. 9, we will strongly encourage the adoption of the Designated Social Care Officer, or DSCO, role in each local area. Including by proposing an amendment to the SEND Code of Practice. 10, extend funding until March 2025 of the Alternative Provision Specialist Task Force, or APST, pilot programme. Which is testing co-location of a diverse specialist workforce in pilot alternative provision schools. Equipping the sector to deliver reform for children and young people is a long-term challenge. And we know that the impact of the cost of living, compounded by the impact of the pandemic, will make this even more complex. Our programmes and policies will build confidence and expertise at every level of the workforce. From teachers and classroom staff through to specialists and to leaders who set the overall direction and culture of their settings. We want ordinarily available provision and high quality teaching to meet children and young people's needs wherever possible. And special support to complement the skills and expertise of the wider workforce. A key aspect of this will be our SEND and alternative provision practice guides, which will equip frontline professionals with the skills and expertise to make best use of provision and to identify needs early, accurately, and consistently. By the end of 2025, we will publish the first 3 practice guides focused on advice for mainstream settings. We will build on existing best practice, such as the Nuffield Early Language Intervention, the work of the Autism Education Trust, and the government's guidance on promoting children and young people's mental health and well-being. We will identify any gaps in best practice and help build a stronger evidence base in the long term. We also know that local authorities' SEND casework teams play a vital role in supporting families to navigate the system and ensuring they have good experiences. Timely and accurate communications are important factors in maintaining parental confidence. Many of the proposals in this improvement plan, such as producing good EHCPs through a template and a digitised system, ensuring redress systems are effective and using multi-agency panels well, depend on high quality delivery by casework teams. We will further consider the skills and training that these teams receive. And when we consult on amending the SEND Code of Practice, we will propose new guidance on delivering a responsive and supportive SEND casework service to families. Case study: Telford and Wrekin's SEND casework team. In Telford and Wrekin, there has been significant investment in how to approach SEND casework. With a focus on securing positive relationships with parents and carers and keeping open communication. The local authority has found that a key part of this is to do the basics brilliantly. A swift response to queries is their priority, and as far as possible, they call rather than email. The team has developed several communication tools with support from its parent carer forum known as PODS. And Send Information, Advice and Support Services, or SENDIAS. They report that the guide they have produced for parents and carers, explaining the EHC assessment 20-week timeline, has been welcomed, as it clearly sets out to the family who their allocated officer is, how to contact them, and what to expect during the 20-week pathway. They also run moving forward meetings as part of the EHC assessment process. Where a difficult decision has been taken, the moving forward meeting, which is always conducted face-to-face at the child's educational setting, allows the officer to talk through the decision with the parents or carers and agree a forward plan. The local authority shares that this informal dispute resolution has been incredibly productive, enabled good quality discussions to take place, and supports endeavours to minimise a fall into formal mediation processes and ultimately tribunals. Every year, the local authority reflects and refreshes its approach. Recently, officers from the SEND team have led parent drop-ins, which include issues such as early intervention, alternative funding and support mechanisms. They have also delivered workshops focusing on parental participation at annual reviews, and report that their family newsletters are very well received. Finally, we are clear that the workforce will be crucial to every aspect of system improvement. Whilst this chapter sets out our vision for the professionals working with children and young people, we will consider the workforce throughout all our reform plans and understand how we can build the right expertise, capacity and culture to put these into place. Improving mainstream provision through high quality teaching and SEND training. Supporting and upskilling the teaching workforce so that all pupils and students have access to high quality teaching and every teacher is able to adapt their practice to meet the needs of the classroom. Teacher quality is one of the most important in-school determinants of pupil outcomes. Reducing the risk that children fall behind due to missed opportunities or lack of appropriate support. High quality, evidence-based teaching is critical in ensuring that the special educational needs of pupils are not misidentified. When their difficulties may be due to poor classroom provision, as well as ensuring that the needs of those with SEN are met effectively. The school's white paper set out an ambitious target of 90% of primary school children achieving the expected standard in reading, writing and mathematics. We know we cannot reach this without the right support for children with SEND. The needs of most children can be met through high quality teaching, and the Green Paper outlined how adaptive teaching for children and young people with SEND already underpins the framework for initial teacher training and early career teachers. We heard, however, that we need to go further if we are going to achieve the aim of improving mainstream provision. So that it is more inclusive of children and young people with SEND. Respondents consistently highlighted the need for ongoing teacher training. And when children and young people who are in alternative provision were asked what would have helped them stay in their mainstream school, the most common answer was teacher training in SEND. We will explore opportunities to build teacher expertise through a review of the Initial Teacher Training, or ITT, Core Content Framework and Early Career Framework. Due to begin early this year, the review will identify how the frameworks can equip new teachers to be more confident in meeting the needs of children and young people with SEND. We are also working with the sector to develop guidance on special schools' involvement in ITT. This will include the appropriate use of special schools for ITT placements and help ensure that providers have confidence to involve special schools and alternative provision in their partnerships. This will enable trainees to benefit from valuable placement experience and enable expertise from special schools and alternative provision to be incorporated into their ITT. We are also providing free SEND-specific professional development, online training, live webinars, and peer mentoring opportunities to school and college staff at any stage in their career through the Universal Services Programme. The programme, which began in 2022, is backed by almost £12 million and aims to reach at least 70% of schools and FE colleges each year until 2025. Delivery is led by NASEN in partnership with Education Training Foundation and Autism Education Trust. Since September 2022, the programme has reached out to over 17,000 schools and engaged 99.5% of FE colleges. Almost 3,000 professionals have accessed free online training and attended live webinars with sector specialists, and 60,000 professionals have undertaken autism awareness training through a Train the Trainer model. Individualised support is also available, with over 80 schools and 135 colleges starting peer reviews to identify ways to improve their SEND provision. We are also expanding training to increase school staff confidence in using assistive technology, or AT. Following the promising results of our initial pilot, we are extending assistive technology training to a further 150 maintained schools. The extension, known as the AT Test and Learn programme, will teach mainstream school staff how to use AT effectively. With a focus on the technology schools already have available or can easily obtain, such as text-to-speech tools. It will build on last year's pilot by training more schools over a longer period and with more impact data to gain a fuller picture of how AT training can support wider SEND continuing professional development. The AT Test and Learn course is free to attend, and the next cohort will run from March to July 2023. Finally, we recognise the recruitment and retention challenges many settings are facing. And we know that more needs to be done to ensure teaching remains an attractive, high-status profession. Continuing to attract, retain, and develop the highly skilled teachers we need is one of our top priorities, as set out in our teacher recruitment and retention strategy. That is why we are delivering 500,000 training and development opportunities by the end of 2024. Alongside a range of resources to help schools address teacher workload issues, prioritise staff well-being, and introduce flexible working practices. Supporting and upskilling teaching assistants so they are deployed effectively to support children and young people with SEND. Support staff play a key role in supporting children and young people with SEND. Some respondents to the consultation wanted to see more action to acknowledge their critical role. Evidence suggests that effectively deployed and well-trained teaching assistants, known as TAs, can achieve up to 4 months progress in pupil attainment. The Green Paper committed to setting out clear guidance on the effective use and deployment of TAs to support children and young people with SEND. We will do this through the new SEND and Alternative Provision Practice Guides, enabling TAs and learning support assistants to make best use of the available provision set out in the national standards. And setting expectations for good practice in meeting the needs of individual children and young people. We will also develop a longer-term approach for TAs to ensure that impact is consistent across the system and the different responsibilities they take on. We want TAs to be well trained and to be able to develop specific expertise, for example, in speech and language interventions. As the first step, we will commission a research project to develop our evidence base on current school approaches, demand and best practice. Targeted programmes and initiatives to improve educational provision. We are investing in the wider school and college workforce and funding evidence-based interventions. That can be delivered to all pupils and students who need them, including those with SEND. This includes 1. Continuing the National Tutoring Programme. To improve the tutoring experience for children and young people with SEND, schools can request SEND specialists, maintain smaller group sizes for pupils with SEND, and align tutoring provision with EHCP requirements. 2. Offering one-to-one tuition and small group support for SEND students and those with EHCPs through the 16 to 19 Tuition Fund. 3. Which covers vocational and academic subjects to provide the skills and learning in preparation for adulthood. 3. Additional teaching and learning hours in 16 to 19 education. To ensure those aged 16 to 25 with an EHCP can benefit, institutions have flexibility to deliver additional hours or appropriate alternative support for these students. 4. Supporting schools to provide a high quality curriculum by establishing Oak National Academy as an arm's length body to provide evidence based, adaptable curriculum resources. Oak's existing resources include specialist lessons for pupils with SEND and therapy based lessons, covering occupational, physical, and speech and language therapy. 5. Tackling attendance barriers for pupils with SEND. We know some pupils find it harder to attend school or alternative provision, so may require individualised attendance support at a higher level to their peers. Our new guidance, Working Together to Improve Attendance, supports schools, multi-academy trusts and local authorities to work collaboratively to address the in and out of school barriers to attendance. For example, an unmet SEND need children and their families may be facing. Six, continuing the Accelerator Fund for another 3 years following its inception in 2021 to 2022. This includes expanding English hubs to 680 additional schools in areas that will benefit most from specialist phonics support. And mathematics hubs projects to help pupils to secure the foundation they need to progress. And which may have been missed due to COVID-19. Equipping SENCOs to shape their school's approach through a new SENCO NPQ. Special Educational Needs Coordinators, or SENCOs, play a vital role in setting the direction for their school. Coordinating day-to-day SEND provision and advising on the graduated approach to providing SEND support. We want to invest in their training to ensure they are well equipped, valued by their colleagues, and the attainment of children with SEND improves. Currently, SENCOs must complete the mandatory National Award for SEND Coordination, or NASENCO, within 3 years of taking the role. To ensure the qualification provides the skills needed for the role, aligns with wider teaching training reforms, and is completed consistently, the Green Paper proposed introducing a new mandatory leadership level SENCO National Professional Qualification, or NPQ. And strengthening the mandatory time frame requirement in which the qualification must be undertaken. We heard through the consultation that introducing a new NPQ sends an important message about the role of the SENCO and the need for it to be whole school, senior and strategic, whilst reflecting the complexity of the system and preparing SENCOs for this. Where respondents saw disadvantages, it was because they felt that the current qualification is fit for purpose and that by changing the type of qualification risks undermining the SENCO role. We heard consistently that there was strong support for strengthening the mandatory requirement to undertake SENCO training. We intend to replace the NASENCO with a mandatory leadership level SENCO MPQ for SENCOs that do not hold the current qualification. Including those that became a SENCO prior to September 2009. To ensure the MPQ is high quality and provides the knowledge, practical skills and leadership expertise needed for the role, we will work with SEND experts to develop the MPQ framework and course design. We are determining arrangements for the transition from the NASENCO to the SENCO MPQ. And as part of this, we will consider how the proposal to strengthen the mandatory training requirement is implemented. We will ensure that any strengthened timeframe requirement aligns with teacher recruitment cycles. That the availability of training places meets demand, and that the responsibility for ensuring the SENCO has the relevant training sits at the right level within a school. Further details on the timings for the procurement to identify providers of the MPQ and the approach for introducing the new qualification will be provided in due course. Ensuring SEND expertise is held at every level. As well as the crucial role played by SENCOs, we heard about the importance of SEND expertise being held at every level, including senior leaders. Senior leaders play a key role in setting an inclusive culture in which individual needs are identified. And where there are high ambitions for children and young people with SEND and in alternative provision. To support excellent SEND leadership, we have one, committed to setting out the first descriptors for Academy Trust strength, which will include measures for a high quality, inclusive education. This will help ensure that trust leaders set the right calm, safe and supportive culture for inclusion. And improving the outcomes of pupils with SEND and in alternative provision. 2. begun work on the new MAT CEO development offer, providing leaders with the knowledge, skills and behaviours to lead improvement at scale, with the needs of children with SEND and those requiring alternative provision embedded throughout. Three, introduced a new NPQ for early years leadership to support current and aspiring leaders. To develop expertise in leading high quality early years education and care which meet the needs of all learners, including those with SEND. 4. Develop the NPQ for headship to support teachers and leaders to develop the knowledge that underpins expert school leadership and enables all pupils to succeed. Including designing and implementing fair and inclusive policies, making reasonable adjustments, and encouraging staff to share best practice on supporting pupils with SEND. 5. Provided training and capability building to senior strategic leaders in local authorities through the Delivering Better Value programme, supporting them to design, implement and embed effective change management and evidence-based decision making. Six, promoted the Local Government Association Leadership Programme, which provides targeted support to senior leaders in local authorities with responsibility for children's social care. SEND is embedded throughout the programme, including training, mentoring and bespoke support to deliver targeted interventions to improve their SEND services. Embedding support from early years to further education. Supporting early years staff to meet need through high quality early years provision. During the consultation, respondents highlighted the crucial role of high quality early years support in preventing unnecessary escalation of need. And providing children with a strong foundation for their future educational journey. Early years staff play a critical role in providing high quality support for all children to help them reach their potential and avoid learning difficulties arising. To support those children who do have additional needs, the Department for Education committed to funding training for up to 5,000 early years staff to gain an accredited Level 3 EY SENCO qualification. Training will run from August 2024 and we have already had over 4,000 applications for the course. Training is available to all SENCOs working in group-based and childminder settings. With additional targeting to specific areas based on levels of disadvantage. In response to feedback from the sector, we have also undertaken a review of the Early Years Educator, or EYE, Level 3 criteria. We have consulted on the inclusion of SEND as a standalone criterion. To ensure that all EYE courses include a specific focus on supporting children with SEND. The consultation response will be published in spring 2023. These changes are being taken forward as part of the Early Years Recovery Programme, which provides a package of up to £180 million of workforce training, qualifications and support for the early years sector. As well as SENCO training and EYE reform, the programme includes 1. Funding for up to 10,000 professionals to undertake early mathematics, early communication and language, and personal, social and emotional development training through the third phase of our professional development programme. The previous phase provided more than 1,300 professionals in 51 local authorities with bespoke training. Improving the support received by an estimated 20,000 children. 2. The National Professional Qualification in Early Years Leadership, or NPQEYL, which includes SEND training. 3. The introduction of up to 18 new Stronger Practice Hubs to support early years practitioners to adopt evidence-based practice improvements. Build local networks for sharing effective practice and cultivate system leadership. A skilled, confident further education workforce. Further education, or FE, plays a vital role in preparing learners, including young people with SEND, for their next phase of their life, including further learning, training and employment opportunities. The Department for Education's Universal Services Programme offers a comprehensive package of SEND training and support for the FE workforce. Including employer-led webinars advising on how settings can prepare young people for adulthood and employment. And additional FE-focused webinars which over 700 college staff and leaders have accessed to date. The programme also offers peer reviews, where FE leaders are given the opportunity to engage in improvement projects. To provide expert support for young people with SEND in FE, we offered bursaries worth £15,000 each, tax-free, in academic year 2022 to 2023. For trainees undertaking SEND Further Education Initial Teacher Education, or ITE. Awareness of individual learner needs and how to respond to these through effective teaching practice is also a key component of the revised Learning and Skills Teacher, or LST occupational standard. We will require all publicly funded FE-ITE programs to be clearly based on the LST occupational standard from academic year 2024 to 2025. To help ensure that all those training to teach in FE can effectively recognise and support learners with SEND. To support recruitment across the FE sector, Taking Teaching Further, or TTF, is a Department for Education funded initiative that helps FE providers recruit and train experienced business and industry professionals to become FE teachers. TTF has been expanded to include a core skills element, which includes SEND. The aim is to equip industry experts to support learners with SEND into employment in one or more of the 15 technical areas. By March 2023, our FE Governance Guide will also include the expectation that the governing body of every FE college corporation should have a SEND link governor. Who would have a particular interest in the needs of students with SEND. Providing specialist support at the point of need. We are committed to improving the supply, training and deployment of key workforces to make the best use of professional expertise at whatever age or stage it is needed and prevent needs from escalating. Our aim is to harness the expertise of each workforce to create a virtuous cycle where the roles and responsibilities of different professionals and sectors are complementary. National standards will play a key role in this by clarifying who is responsible for delivering provision and from which budgets. The Green Paper recognised that children and young people need access to the right specialists. But are currently facing delays in accessing this professional support. Through the consultation, we heard further about the challenges presented by long waiting times and staff shortages when it comes to receiving support from specialists. In the Green Paper, the Department of Health and Social Care committed to working with the Department for Education, NHS England and Health Education England to commission analysis to better understand demand for support for children and young people with SEND from the health workforce. So that there is a clear focus on SEND in health workforce planning. The analysis will cover key allied health professionals, including speech and language therapists and occupational therapists. Building on this analysis, the Department of Health and Social Care and the Department for Education will work together to take a joint approach to SEND workforce planning, informed by a stronger evidence base. We will establish a steering group in 2023 to oversee this work. Which will feed into the National SEND and Alternative Provision Implementation Board and aim to complete it by 2025. Increasing the number of educational psychologists, we know that educational psychologists play a critical role for children and young people with SEND. In the EHCP assessment and review system, but also in providing early identification and intervention to support the needs of children and young people and prevention of escalation. In response to the consultation, we heard about the difficulties in securing timely access to educational psychologists. In the Green Paper, we outlined the steps we are taking to increase the number of educational psychologists. Including our investment of £30 million to train 3 cohorts which started in academic years 2020, 2021 and 2022. Since the Green Paper was published, we have announced a further £10 million for a cohort of over 200 trainee educational psychologists starting this year. And a further £21 million to fund 400 more trainees commencing in 2024 and 2025. Access to therapists in areas of need. There is strong evidence that without receiving the right support early to address speech, language and communication needs, or SLCN, children are at increased risk of poor educational attainment, poor social, emotional and mental health, and poor employment outcomes. In partnership with NHS England, we will include Early Language and Support for Every Child, or LSEC, Pathfinders within our £70 million change programme by supporting 9 ICBs. On one of the local areas within each of our 9 regional expert partnerships to trial new ways of working to better identify and support children with SLCN in early years and primary schools. The aim of the LSEC Pathfinders is to 1. Provide earlier identification and support to children and young people with SEND. To reduce the number of children and young people requiring an EHCP to have their needs met. 2. Build evidence of new ways of working to better and earlier identify and support children with SLCN that could be rolled out more widely. 3. Test the impact on pupil outcomes such as attendance, attainment, behaviour, mental health and well-being over the 2 years of the pilot. This will build on existing initiatives to increase the supply of speech and language therapists and occupational therapists to the NHS. Since September 2020, all eligible undergraduate and postgraduate degree students have been able to apply for a non-repayable training grant of a minimum of £5,000 per academic year. With further financial support available for childcare, accommodation and travel costs. Local inclusion plans will also set out each area's strategic approach to ensuring sufficient education workforces to deliver effective services. Training teachers of children and young people with sensory impairments. We are committed to ensuring a secure supply of teachers of children and young people with visual, hearing and multisensory impairments in both specialist and mainstream settings. The importance of these roles came through clearly in consultation feedback, and we recognise concerns regarding the number of teachers of the deaf. Those teaching classes of children with sensory impairments must hold an appropriate qualification approved by the Secretary of State. The mandatory qualification for sensory impairment, or MQSI, teachers working in an advisory or peripatetic role are also strongly advised to complete MQSI training. In the best interest of the children and young people with whom they work. To support the supply of teachers with an MQSI, we have already developed a new approval process to determine providers of MQSIs from the start of the academic year 2023 to 2024 and issued contracts. The Institute for Apprenticeships and Technical Education, or IFATE, are also developing an occupational standard for teachers of sensory impairment. This will open up a paid, work-based route into teaching children and young people with sensory impairments. By enabling people to undertake high-quality apprenticeships. This will improve the supply of those qualified to teach this important cohort and further help to improve their outcomes. The apprenticeship will attract levy funding, meaning those wanting to undertake it would be funded to do so whilst being in paid work. This will help to open up the profession to individuals from lower socio-economic backgrounds. IFATE are working with universities, local authorities and sector representatives, including the National Deaf Children's Society, the Royal National Institute of Blind People, and the British Association of Teachers of Deaf Children and Young People to develop the qualification and expect it to be available from 2025. In addition to this, the Department for Education are exploring further options to maximise take-up of MQSIs. with a view to improving the supply of teachers for children with sensory impairments. Building the health workforce through expanded apprenticeship routes. As Chapter 3 outlines, we are delivering an extensive package of professional development to the apprenticeship provider workforce. Alongside this offer, our wider work to support growth in apprenticeships is enabling us to support the growth of the health and care workforce. We have seen strong growth of registered nursing degree apprenticeships in recent years, with 3,420 starts in 2021 to 2022, compared to 1,040 in 2018 to 2019. There is now a complete apprenticeship pathway in nursing from entry to postgraduate advanced clinical practice. For example, a person could join the NHS as a Level 2 healthcare support worker apprentice, progress to a Level 5 nursing associate apprenticeship, then on to an accelerated Level 6 registered nurse degree apprenticeship. Health Education England have worked with NHS trusts to support nursing associates' progress onto registered nurse apprenticeships, completing 1 or 2 years more quickly than their counterparts coming through the typical apprenticeship. People wanting to train as a doctor could achieve their degree by an apprenticeship route from 2023 to 2024, which aims to widen access and participation in undergraduate medical education and deliver better care to patients through a diverse workforce that is more representative of local communities. NHS England are developing a long-term plan for the NHS workforce that will look at the mix and number of staff needed in the future. The plan focuses on the practical action the NHS will look to take, working with partners in government to grow and transform the workforce, and to continue to embed compassionate and inclusive cultures. This includes continuing to grow apprenticeship opportunities from entry level to postgraduate advanced clinical practice. The Department for Education are working with the Department of Health and Social Care to support the growth of apprenticeships needed for the long-term workforce plan. By 2024 to 2025, we will increase investment in apprenticeships across all sectors to £2.7 billion. In addition to making up to £8 million available in 2022 to 2023 to higher education institutions to expand their degree apprenticeships provision. Bringing services together. We know that for children and young people with complex needs, joined up working across health, education and care services is particularly important. To support both early identification of needs and to make sure the right support is put in place as early as possible. We will build upon the good practice initiated through cross-government commitments in the NHS long-term plan and for autistic children and young people, and those with a learning disability, the Building the Right Support Action Plan, published July 2022, to drive faster progress. The Building the Right Support Action Plan brings together actions across government and public services to strengthen community support and reduce overall reliance on mental health inpatient care. Building on last year's investment of £13 million, NHS England are investing £2.5 million in 2022 to 2023 and £1.5 million in 2023 to 2024 to improve autism diagnostic pathways. NHS England are also developing national guidance for integrated care systems about how to improve access to an autism diagnosis assessment. The NHS long-term plan also set out that by 2023 to 2024, children and young people with a learning disability and/or who are autistic with the most complex needs will have a designated key worker. Implementing the recommendation made by Dame Christine Lenihan. Initially, key worker support will be provided to children and young people who are inpatients or at risk of being admitted to a mental health hospital. Key worker support will also be extended to the most vulnerable children with a learning disability and/or autism. The community key working model was developed through extensive consultation with young people, parent carers and other stakeholders. And what Family Said Mattered has been written into the framework for what key workers must deliver. Key working services make sure that local systems are responsive to fully meeting the young people's needs in a joined-up way. To provide care and treatment in the community with the right support whenever it is possible. The key working services established in the pilot and early adopter phases within health, local authority or voluntary and community sector hosts actively bring together support to avoid admission, facilitate robust support on discharge, and achieve positive outcomes for children and young people and their families. The model is now being rolled out across all areas. To improve early identification, the Department for Education has also invested £600,000 into significantly expanding an autism early identification pilot in at least 100 schools over 3 years, including 10 currently running in Bradford. A neurodiversity profiling tool will empower schools to provide early support for children's needs and decrease the downstream pressures across the system. The Department for Education has since developed a series of pathfinders into 4 new areas, seeking to understand potential for further development. Case study, NHS England Autism in Schools project. The Autism in Schools project was co-produced by NHS England, parent carer forums and local authorities in North Cumbria and the North East. To support autistic children and young people by creating positive environments that support mental health. The project was rolled out in over 300 schools across ICBs in England between 2021 to 2022 and 2022 to 2023. Following a successful pilot in North Cumbria and the North East. And continues to have positive outcomes for children and young people, families and schools. Projects were based on bringing education, health and social care services together. Providing learning opportunities for school staff and developing the support available to autistic children and young people. As part of this, most of the schools undertook environmental assessments, also referred to as a sensory audit or learning walk. These explored the sensory aspects of the school environment and were led by occupational therapists, educational psychologists, mental health support teams and local charities. School staff reported that engagement with the project has made them more open to change, helped them feel empowered to better support the needs of autistic children and young people, and supported them to develop stronger relationships with parents, carers, and other professionals within the system. Schools also reported finding the whole school training on neurodiversity delivered through the projects especially helpful in allowing them to make reasonable adjustments that support young people to engage in learning, such as low stimulus areas in classrooms, timeout passes, and individual resource boxes. Alongside these practical adjustments, schools also reviewed policies and made changes to behavioural and uniform policies to meet the needs of neurodiverse learners. The Health and Care Act 2022 introduces a new requirement for CQC registered providers to ensure their staff receive specific training on learning disability and autism, which is appropriate to their role. To support this new training requirement, the government have made significant progress on the Oliver McGowan mandatory training, which was trialled in England during 2021 with over 8,000 people. Part 1 of this training, an e-learning package, became available in November 2022. Providing mental health support to children and young people. Meeting children's social, emotional and mental health, or SEMH, needs is a crucial aspect of strong SEND provision. Schools and colleges play a vital role in promoting and supporting pupil and student mental health and well-being. They work to create safe, calm, supportive and inclusive environments, tackle bullying and teach pupils and students about their mental health and about when to ask for help. Through daily interactions, staff can validate children's feelings, boost their confidence, and increase their resilience. Many education settings also offer targeted support, for example through play therapy or counselling, or a nurture or social skills group. However, as the NHS long-term plan recognised before the pandemic, we know many families, children and young people struggle to get timely access to additional specialist support from mental health services. Investment in NHS children and young people's mental health services is growing faster than both NHS funding and mental health investment overall. And the specialist workforce has been growing as a result. A £79 million funding boost in 2021 to 2022 to expand children's mental health services has helped allow 22,500 more children and young people to access community health services, on top of growth already planned in the NHS long-term plan. This funding has also accelerated the rollout of mental health support teams, or MHSTs, in schools and colleges, which will be expanded to around 400 operational teams later in 2023, covering around 35% of pupils in England. And reach around 500 operational teams by 2024. Setting teams up involves training a new workforce of educational mental health practitioners to work across health services and schools. This is part of an additional all-age investment of £2.3 billion a year into NHS mental health services by 2023 to 2024. Part of this investment will enable an additional 345,000 children and young people to access NHS-funded mental health support. The independent process evaluation of the Children and Young People's Mental Health Support Team Trailblazer programme identifies substantial progress in MHST implementation despite challenges presented by the pandemic. Pupils and students had positive experiences of the first 25 MHST Trailblazer sites it examined. And school and college staff grew in knowledge and confidence around mental health. The programme has evolved since the Trailblazers were launched, and the findings will continue to inform the future rollout and mobilisation of MHSTs. To further support positive holistic approaches to promoting and supporting mental health and well-being, we are also offering all state schools and colleges grants to train a senior mental health lead by 2025, backed by £10 million in 2022 to 2023. Over 10,000 schools and colleges, including more than half of state-funded secondary schools in England, have taken up the offer so far. To supplement the senior mental health lead training, we are developing an online hub of practical tools and resources to help mental health leads in schools and colleges. To develop and sustain their whole school or college approach to mental health and well-being. and a toolkit to support schools and colleges to plan their pastoral offer for pupils and students with social, emotional and mental health needs. The recently published Children's Social Care Implementation Strategy, committed to reviewing mental health content included in social work qualifications, early career training and continuous professional development by the end of 2023. Including ensuring identification and response to poor mental health issues is embedded in workforce training programs. Extending the Alternative Provision Specialist Task Force Pilot, or APST. The APST pilot co-locates a diverse specialist workforce in an alternative provision school with a blended team of specialists providing wraparound support and early needs assessment. Youth and family workers build trust with pupils and families. Speech and language therapists develop pupils' communication skills. Post-16 coaches support aspirational transitions. Youth justice workers prevent offending and reoffending. And mental health therapists improve social and emotional regulation. The APST pilot addresses a critical gap in the evidence on effective practice models in alternative provision. By evaluating the impact of embedded multidisciplinary specialist support on attendance, attainment, engagement with education, social and emotional well-being, reintegration into mainstream, and post-16 transition. Since November 2021, 22 alternative provision schools have worked with over 2,500 young people. Feedback from APSTs is demonstrating the value of building trusted relationships and offering timely and accessible support. In addition, co-locating the core group of specialists is improving staff training and enabling a holistic understanding of and response to a child's needs. The pilot is being fully evaluated by independent evaluators in partnership with the Youth Endowment Fund, which will result in a full impact evaluation. The APST pilot will now be funded to run until March 2025. An extension to the pilot will teach us more about the impact on engagement in education, how to secure funding sustainability, and how to recruit and retain specialists. We will incorporate the evidence from this pilot into the new National SEND and Alternative Provision Standards and Practice Guides. To ensure expectations for system leaders and frontline professionals are based on existing best practice. The evidence should also encourage local areas to consider this model as an effective strand of their SEND and alternative provision inclusion plans. The APST pilot also provides a valuable opportunity to understand how a specialist task force can develop the role of alternative provision in the wider school landscape. Case study, Alternative Provision Specialist Task Force Pilot, Ruben's experience. Note, the name of the student in this case study has been changed. Ruben is in secondary school. His SEND needs include dyslexia, ADHD, social communication difficulties, and learning difficulties. He lives with his mother and his younger siblings, a toddler and a premature newborn, in a one-bedroom flat. Ruben often does not get to sleep before 1 a.m. and is torn between helping his mother and attending school. His school attendance is historically low. He has a history of offending behaviour associated with being a victim of child criminal exploitation. The APST's family worker conducted home visits, made regular phone calls, and visited Ruben at school. The mental health lead gave Ruben's mother safety advice around managing a newborn child in restricted living arrangements. And advised on an approach to support Ruben's emotional well-being. The youth offending worker took Ruben on as a prevention case, bringing additional intelligence to inform his safety planning. The APST's interventions have meant that Ruben has been kept safe. While improvements in Ruben's attendance are still being established, he is engaging and benefiting greatly from the support of the specialists. The task force is also arranging for him to access speech and language therapy. Ruben is being supported with his post-16 transition options and has now started to look to the future. Looking at possible careers, Ruben has said he would like to be an engineer in the future. The role for alternative provision schools in providing early outreach support for mainstream schools. There is also a key role for special and alternative provision schools in providing early outreach support. This can help mainstream schools with pupils demonstrating challenging behaviour or having difficulty engaging in their education, and sits alongside the Department for Education's Behaviour Hubs programme. Case study, Alternative Provision Outreach Support. St George's Primary is one of 62 primary schools within Wandsworth Local Authority, where pupils benefit from local targeted alternative provision outreach support. The funding for this is provided directly from the local authority as part of its universal SEND offer. The outreach offer supports around 200 of Wandsworth's most vulnerable pupils. Many have multiple overlapping needs, including contact with social services and SEND, particularly social, emotional and mental health needs. The offer includes 1. Short-term emergency support in response to specific incidents. 2. One-to-one support for individual academic, curriculum and behaviour needs, including emotional regulation and literacy, and improving social skills. 3. Access to specialist support like mental health services, speech and language therapists, or educational psychologists as part of the local Team Around the Child meetings. In St George's, this is being delivered in a specially designed in-school nurture space. The support from the Alternative Provision School gives its pupils the confidence to engage in their education within a calm, safe and supportive environment. The school's head teacher believes that this collaboration has provided valuable support which has improved the children's well-being. And reduced the risk of suspension or preventable permanent exclusion. Support from social care. We recognise the importance of aligning SEND reforms with those set out in the Children's Social Care Implementation Strategy. Together, the reforms are designed to create a stronger and more stable network of professionals. To deliver improved outcomes for children, young people and their families. This includes strengthening social worker training through the new Early Career Framework, to ensure social workers have skills and knowledge to meet the needs of different cohorts of children. And investing in family hubs to provide multidisciplinary support. We are developing stronger national guidance for leaders and practitioners through the Children's Social Care National Framework. Setting principles for practice and the outcomes that children, young people and families should achieve. This approach reflects the ambition for clear national direction for practice and mirrors the focus on a consistent and robust offer of support. With help being made available at the earliest stage without stigma. The same principles which underpin the proposed national SEND and alternative provision standards. We will develop frontline practice guides, including for professionals working specifically with disabled children. To make sure they know how to communicate with children with a disability and provide appropriate help and support to families. The designated social care officer role. Many of our proposals, such as standardisation of EHCPs and introducing multi-agency panels, will improve integration of services and accessibility of support. In the Green Paper, we advocated for the adoption of designated social care officers, or DSCO, and proposed to use findings from a pilot supported by the Council for Disabled Children. To establish what a high-quality standardised DSCO role would look like. We will strongly encourage the adoption of the DSCO role in each local area, including by proposing an amendment to the SEND Code of Practice. the job description and practice expectations for the DSCO. Will provide the capacity and expertise to improve the links and contributions from care services into the SEND process. Similarly to the DCO or DMO role in health, the DSCO role will support both operational input, such as the contributions from care to education, health and care assessments and reviews, and more strategic planning functions, such as the commissioning of care services such as short breaks. For disabled children and those with SEN.